back. We have another Derm Reacts video, and today we're joined by Dr. Sam Ellis.
Hi.
She's a board-certified dermatologist in Northern California, and today we're looking at a really interesting routine. I always say they're interesting. I'm always like, fascinating. This is like a day in your life, and I'm like, this is so interesting.
My job is interesting, okay?
Yeah. Exactly. Today we're looking at Dana, and she has something that was diagnosed by her dermatologist as acne rosacea. So acne rosacea, interesting, because I didn't know that there was like a difference, really. I know nothing about rosacea, really, when it comes down to it.
That's okay. You're not alone.
But I know that a lot of people deal with rosacea. Looking at her pictures, what would you say? I mean, she's been diagnosed already at this point, right?
Right, yeah. So rosacea tends to have that more central facial involvement, so cheeks, nose, forehead, and chin, and then sort of have this background redness. And a lot of people think rosacea is only redness, but you can have lots of bumps, which we call papules, as well as pustules, so pus-filled bumps, with rosacea. The thing with acne and rosacea is they can both manifest with similar findings, and so sometimes, especially in younger patients, they'll either have both conditions going on, which kind of muddies the picture, or the rosacea will have an acne pattern, and then in both cases we would call it acne rosacea.
So would you treat that differently than typical acne?
Yeah, I typically treat it more as rosacea, just for me in my own practice, just because rosacea prone people tend to have more sensitive skin, so we have to be really careful with what kind of actives we're having them incorporate. And then if they're not responding optimally to the rosacea treatment alone, then adding in some specific acne fighting ingredients is a nice way to go.
You know, we've talked about rosacea on this channel with other dermatologists and stuff, and a lot of the time I hear that you don't get diagnosed with rosacea until you're older, at least 30s and stuff. Do you think it's one of those things that maybe this might be, like, we're finding more and more that it's maybe happening in people that are younger?
I'm not sure. I mean, we do think of rosacea as being a skin condition that's mostly of people age 30 and up, but I definitely see patients in their 20s and even some in their teens who absolutely have rosacea. So just because it's most common in people over the age of 30 doesn't mean that people under the age of 30 can't have it.
All right, so before we get into her video, if you love skincare, make sure you like this video and subscribe to the channel. And also, if you want to send in your skincare routine, feel free to look in the description box where we have more information.
Hi, my name's Dana. I wanted to take you guys through my skincare routine. I'll start with the morning. So typically in the morning, I cleanse my face with Cetaphil, just the gentle skin cleanser. Then I'll go in with the Prosacea Medicated Rosacea Gel.
All right, so she starts off cleansing her skin in the morning. Do you think for somebody that has rosacea, acne rosacea, I guess I always picture sensitive skin, so then I think sensitive skin shouldn't cleanse their skin in the morning, but I'm making things up, right? So I don't actually know. I don't deal with rosacea myself, so
yeah, I think that generally if you do have sensitive skin, if you tend to be dry, if you have rosacea, that morning cleanse really tends to be unnecessary. So I think just a little bit of water in the morning to set your skin up is generally all that's needed, even when you're using as gentle of a cleanser as Cetaphil.
This next product that she uses, Prosacea, I've actually never even heard of this. What are your thoughts of it?
Yeah, so this is an over-the-counter rosacea targeted medication. It's sulfur based, which is anti-inflammatory and antimicrobial, so it can help with rosacea. It's not like gonna knock rosacea out, but for people who are sensitive, that are redness prone, it can be a helpful product to have in the lineup.
Then I'll follow up with the Moisturizing cream from CeraVe.
So then she goes in with the CeraVe moisturizing cream, very straightforward. I have no
qualms
notes.
with that.
Yeah,
love that one.
The Bare Republic Mineral Sunscreen Lotion, 30 SPF. I have been to a dermatologist where they diagnosed me with acne rosacea. So very red in the skin, have the little bumps, whole 9 yards. Tons of fun.
As far as that sunscreen goes, I used this such a long time ago. I personally felt like it was a little bit thick.
That's what I remember, it not being as cosmetically elegant as I wanted, but I mean, the ingredients are fine. It's got good, broad spectrum coverage.
Yeah, that's what matters the most. I mean, I feel like sunscreen is actually really important to bring up because she's a redhead. It's always important to wear sunscreen, but specifically with redheads, and also for someone who's dealing with rosacea,
Absolutely.
right?
Rosacea, one of the most common triggers for rosacea flares is UV radiation and sunlight. So the fact that you're protecting, and we see her protecting, is huge. It's essential.
Yeah. Is this a time, and I don't want to discourage her because she's obviously using sunscreen, which is the most important step, but is this a time maybe that we would say that an SPF that's higher than 30 might be more important?
Maybe. So the differences between SPF 30 and SPF 50 are pretty negligible if you're putting enough of the product on. It blocks 97% versus 98% of UV radiation when you use the right amount. But most people don't put that full thick coat of sunscreen on, so it's worth considering using an SPF 50, planning for maybe some under application.
So before we discuss her morning routine, I think we should look at the nighttime too, to see what she's doing,
Get
right?
the full picture.
Yeah.
As for my night routine, I do CeraVe foaming facial cleanser. And after that, I follow up with Dapsone Gel that my dermatologist prescribed.
Nighttime routine, she actually switches cleansers and she moves on to the CeraVe foaming facial cleanser. I think it's totally fine when you have oily skin. I think it's a little bit more of a drying cleanser versus like the Cetaphil, which is just really basic, right?
Yeah, absolutely. And I think that foaming, gives people that satisfaction of a cleanse, and that's why they reach for foaming cleansers. I totally get that. I do that too. But if you are prone to dryness or irritation, sometimes some of these foaming cleansers can be a little harsh.
Okay, so now we're saying that she does have a prescription product, right? Dapsone. What do you think about that?
I like Dapsone. It's typically a treatment I think of for acne. It's anti-inflammatory, it's antimicrobial. It's not as commonly prescribed, mostly because it's very hard to get it covered by insurance.
Oh.
Yeah, but it can be a really nice anti-inflammatory, especially for people who are not responding to maybe more traditional or commonly prescribed acne topicals.
You're talking about like the retinoids and like...
Retinoids, benzoyl peroxide, clindamycin, that type of thing.
Lastly, I use this Exuviance overnight transformation complex. It has hyaluronic acid, botanicals, PHA. Does a really good job of calming my skin down, it seems like.
All right, this Exuviance Overnight Transformation Complex, I've never used it. I'm a big fan of PHAs.
Yeah, they're great.
I think a lot of people associate them with this like very mild exfoliation, but what I personally like them for is the hydration.
Yeah, they draw water in. I mean, they're great for hydration.
Yeah, I really, really like that. But this is really interesting to see in someone's routine that has acne rosacea, so I'd love to hear your thoughts on it.
Yeah, and I think for her too, she's probably using it more in a hydrating capacity, especially the fact that she says that her skin feels good after using it and not stripped or irritated, which can happen with using more harsh exfoliants, that she's really using it for its moisturizing benefits, and it seems to be working well for her.
If I'm really breaking out in rosacea, I'll go in with this sodium sulfate sulface to my sulfur cleanse that my dermatologist prescribed. But that's pretty much it. I haven't really found any relief from my acne rosacea. It seems like no matter what I use, things just get worse. So looking for some advice. Thanks, guys.
I feel so sad when I hear that. It's like I've been trying all these different things. She's obviously seeing a derm.
Right.
And she feels like nothing's working. That cleanser that she threw in there, it's a sulfur cleanser. So that means that she's probably using that instead of her CeraVe foaming cleanser when she's having a pretty bad breakout, she said.
That's what I would expect. Yeah, that sulfur sodium sulfacetamide is a prescription cleanser that we give to people with rosacea. But what I thought was kind of interesting is she said that she only uses it when her rosacea gets bad. And I caution people to like cherry pick when they're using their products. It's so important that even when your skin feels good, that you're still using your prescription medications, especially, talk about it with your dermatologist, but I encourage people not to back off of use just because their skin feels good, because that's right when that flare is getting ready to gear up again.
I see so many people say that they stop using a product because it stopped working for them. What were those commercials back in the day? Maybe I'm really aging myself. I think it was like a deodorant commercial. It was like, you use this product, you don't even have body odor. And they're like, exactly. Because they're using their deodorant.
Yes, that's why people are like, you don't need Botox, you don't have wrinkles. And I'm like, that's why. Yeah.
Exactly. And it's kind of the same concept. It's like you keep using these products even when your skin looks good, unless your doctor told you not to.
Yes.
So really, it comes down to she seems to be doing what she's supposed to be doing, or seemingly supposed to do, right? Yeah. What do you do in this case? Obviously, she should go back to her dermatologist and say, this is not working for me. What do we do now?
Right.
But if she were sitting in your chair, what would you be saying to somebody like this? And before you answer that, a reminder, this is not medical advice. Obviously, this is not a patient relationship here. Right. This is you just kind of giving a little bit of a perspective.
Yeah, and just my general approach to people who are struggling with rosacea that they feel is not optimally controlled. So the first thing I do is I have a conversation with the patient, and and remind them that rosacea is a lifelong condition. It's something that is going to be there running in the background no matter how good your skin looks or feels. And so we really have to get at with the patient what their goal is. Is their goal to never have a breakout again? Is it just to control redness? And once you understand their goals, you can kind of decide how aggressive you want to be with prescription medications. Because I think here, she has a great over-the-counter routine, and there just might be some little topical additives that are prescription that could give her that little boost to make her more confident and happy with her skin.
So let's take a look at her morning routine. Cleanser, Cetaphil, totally fine.
Great.
She's using that Prosacea. Do you think that maybe she needs something else?
Not that's over the counter, I would say.
Yeah, okay, so you're kind of getting at the, like, if it's not working, maybe we need to up this.
Yeah, maybe we can up the ante a little bit.
Yeah. You know, what do you say to people when they want to only use over-the-counter products, or when they're looking for more of that straightforward approach? I know I'm guilty of this. I don't sometimes want to start a prescription. Like, I was prescribed oral spironolactone, and partially because, you know, I'll get like the hormonal breakout, and then occasionally with like melasma and stuff like that, like there's just like reasons to get on it to have just beautiful skin.
Right.
But I didn't do it because I was like, I don't want to commit to this.
Right, it's a big commitment. And what I often will say to patients is, you know, your skin condition, your acne, your rosacea, it's not going to kill you, but it's really about how much does it bug you, what do you want to do, how many steps do you want to take to get it to a place that you're happy with. And when we're looking at certain things that are available over the counter, we might be limited in how much improvement we can get with that. And just if you understand that and you're okay with that, we can talk about it, but know that I have a few other things in my back pocket if you kind of want to bring those into your routine too.
When would be the time to maybe start using the, or, you know, use the over-the-counter products and ingredients?
I think if your condition is mild, you're not getting any residual scarring from it, it's not something that you're thinking about every day. If you're thinking about your skin condition every day, you're looking in the mirror and you're sad, you know, because of your skin and it's not responding to your over-the-counters, that's the time to seek out a dermatologist. But mild acne, mild rosacea, they absolutely can be managed with over-the-counter products too.
So that said, with the morning routine, you probably wouldn't change anything besides maybe adding something prescription if she went to go see her dermatologist.
Yeah.
As far as the nighttime routine, it sounds to me like you prefer she just stop using that CeraVe foaming cleanser and just always use her sulfur cleanser.
Yeah.
Right. This is why her doctor gave it to her, right?
Yeah, it's probably meant for nightly or consistent use. You have to remember that a lot of times products require consistent use over time to see the best results, and sporadic integration into your routine is not going to always give you the consistent results you want with your skin.
Thinking about that Dapsone, is that a prescription if she's not seeing enough like change in her skin? Is this a time when maybe a dermatologist might go ahead and say, let's switch to something else?
Totally, and I think usually we give people around 8 to 12 weeks, maybe up to 6 months, depending on which topical it is, to kind of give it its proper chance to work effectively. And then if it's not really doing what we want it to, at that point in time, you gotta change it up.
Yeah, are there, you know, like oral medications and stuff that a dermatologist might explore as well?
Yes, definitely. I think oral antibiotics are probably a mainstay treatment for rosacea, but you have to be on them long term generally to keep that control. And that's a big commitment to be on antibiotics long term. So it's always a conversation I have with my patients, and to see, again, how much is their disease bothering them? What kind of symptoms are they having? What do we need to do to really get that fully under control?
Okay, wait. So I hear all of the dermatologists come in here and say that they put people on antibiotics, right?
Yeah.
And you know the first thing that comes to mind for me?
Yeast infection?
Yes. For women, this is a problem.
Yeah.
So is there kind of like a multiple situation here happening with the prescription?
Yeah, I mean, it's definitely something we talk about, and there are certain people who are going to be more prone to yeast infections than others. I mean, we typically will use lower dose antibiotics more for their anti-inflammatory effect than their antimicrobial effect, and that can sort of mitigate those yeast infection side effects. We put them on probiotics, we have them drink yogurt or yogurt-based beverages to kind of help with that. But there are certainly patients who just can't be on antibiotics long-term because they're too prone to yeast infections.
This is good. I've always wanted to know this.
The things we really need to know, but it's true. I mean, like, that would be a huge hindrance to someone being compliant on their medication. And some people can't tolerate it because it causes too much stomach upset or other things. So that's always something that needs to be discussed and explored.
That's good to know. Yeah, and even just hearing that you usually prescribe antibiotics at a lower level, like I'm thinking about like after my C-section, the antibiotics and stuff like that. It was like strong.
Yeah.
We're trying to stop infection down there.
Right, yeah. And I think people are, you know, acne and rosacea, they are not infections, but it's more the skin's reaction to bacteria or mites or other things on the skin. And so really you're just trying to get that anti-inflammatory effect more so than the antibacterial effect of the antibiotic.
Let's talk about mites. Because we are talking about rosacea in this video specifically. I think a lot of people don't like hearing this, but I think we need to discuss it slightly.
Yeah, so there is a very small mite, so an 8-legged creature that lives on all of our skin called Demodex. And it's on everyone, first of all, but it gives you the heebie-jeebies to think about it. They are microscopic. You absolutely cannot see them, but if I take like a little scraping from someone's skin in clinic and I look under my microscope, you can see them. And for people with rosacea, we think that they probably have an excess population of these Demodex mites, but also probably just more of an inflammatory reaction to them. So sometimes you don't have more, but the way your skin responds to them is more inflammatory.
It's fascinating to me when you start to really think about like this symbiotic relationship we have with different...
They probably have some type of byproduct that comes off that is irritation, but I'd have to look into it.
Oh, but again, we all have it. I mean, just wipe it off.
I know.
Wipe it off of me. Just gotta live with it. It's like dust mites and stuff too, right?
Yeah.
You think about it and you're like, oh, they're living on all of our stuff.
Yeah. They're everywhere.
Yeah, but it's definitely something. There's some correlation with people with rosacea, right?
Absolutely, 100%.
All right, so I guess with all that said, it's another one where we're gonna say, time to go back to the dermatologist. I hate saying that. I always feel like, oh, I brought one of the best dermatologists in. We're gonna help you out. But this is one of those situations where it sounds like you do need a prescription. Right?
Yeah, and it's actually a compliment that you're doing all the right things with your topical regimen that you can do on your own, and it's not wrong to have to bring in a professional to kind of optimize your skin.
Thanks so much for watching this video. Again, if you want to submit your own skincare routine, look in our description box where we have the information. You can also find Dr. Sam Ellis here on social media. You want to tell them where?
Yes, I have an Instagram account at Dr. Samantha Ellis, and I now have a YouTube channel as well.
Yay! We'll leave that in the description box as well. You can find me on Instagram at Susan Yura. We'll talk to you guys soon.